the interdisciplinary part of the program, that it wasn't just all other mental health therapists. It was also people like physician assistants who were in the medical science aspect of it, which we had many of our classes were shared together. There was other like dentistry and such. So it was really cool to be able to talk and collaborate about healthcare and patient care and protocol with the intersection, because that's one of the reasons why I really wanted to be in this Doctor of Health Science program. My career beforehand, before I was in mental health care as a clinician, licensed clinician, my work was in healthcare leadership at Kaiser Permanente. I was able to take literally this program and integrate what my current career is as a licensed clinician with my previous career being a hospital leader, and really start to refine a lot of what I want to do to mainstream both of them together. I had been collecting research since before I even began the program, knowing I wanted to publish so badly, because that was my biggest goal, was to do that. The biggest challenge was I poured into the work. I poured into the research. Like when you're in the program, you go, I'm investing in this. And so you don't have free time with your family. You don't have free time with your friends. You literally are just only working in your career to earn money, and working on your doctoral program and your research project. So I had invested so much that when my manuscript, the first few drafts would come in, my doctoral advisor would see, like, you have to reduce it down, reduce it down. That was the hardest part for me, was to really refine it and get that much more concise to get it ready for peer review. The work that I did with my doctoral advisor and trying to learn to reduce how much I needed to put in there, I think that was the biggest challenge for me. My publication in the Pacific Journal of Health, which I'm very proud of, is named Nature Healing Mental Stress: What the United States Healthcare System Can Learn from Other Countries. So that was the whole thing that I was expanding on. It's the fact that I would love to just elaborate on and on and on about it. But what I brought it down to, because it's a health science publication and doctorate, is what is the science that's behind it. And so a lot of people don't understand that nature immersion is more than just sort of a woo-woo science. There's actually some hard evidence that is based in studies from Japan, China, Italy, Canada, Australia, all in my manuscript that you can read online, that talks about the phytoncides, negative ions, fractal structures that actually help us reduce our mental stress when we take concerted time in forested environments or natural environments where there's wind or water, and that our stress levels can go down in that significant way. So it hasn't changed really the structure of my business, but what it did change is the trajectory of what I'm looking to do with my work, to being more than just being clinical, that I want to do much more now that I have this doctoral degree and that I've gotten this research publication under my belt, that I want to do much more in regards to research within my field, and taking that research and putting it into more of a formal presentation and formal publication. So it has changed the trajectory of how I see and envision myself professionally down the road. My clinical expertise are really in interstate complex relationships and in neurodivergence. I'm a certified autism spectrum disorder clinical specialist, as well as being a licensed marriage and family therapist and professional clinical counselor in all of these various states. What it did do for me is, in writing and publishing in a peer-reviewed format that's scholarly, it provided that vigor for me to be able to get out and take those other clinical expertise and passions for me to start working on those manuscripts in a more mainstream way. I'd like to get them out there, not only in the Pacific Journal of Health, but in more of your other periodicals that more people are going to be picking up and reading, such as, in Psychology Today or The Counselor. I've submitted for 2 proposals already in the American Counseling Association and the California Association for Marriage and Family Therapy to present on ADHD and attachment injuries in an epigenetic format of understanding how epigenetics and intergenerational trauma informs how ADHD and attachment injury show up in our clients. I've submitted proposals just recently, and I don't think I would have done that if I hadn't had the kind of training and the kind of the scholarship that goes with what you learn in the doctoral program in the DHSc. There are 3 people currently in the DHSc program taking the classes and doing it right now based upon my based upon what I did and what I've achieved in that. Nothing that is easy is going to be worthwhile in life, right? You gotta just trudge through it. If you really want it, you gotta go through the difficulty of a program like this. It's intense. It's very magnified, being condensed in the way it is, but it's really worth it because the skills that you learn and frankly, the feeling of confidence that you get after you've mastered a program like this, it does create this sense of motivation and ability that can take my career now to a different trajectory that otherwise I may not have had achieved if I hadn't done the program. And it's a good feeling to feel like that you can be a mentor to other people saying, I want to do that too. That's how I feel about my other girlfriends that are in the program. I'm like, yes, I feel like I'm a positive role model for them too, moving through the program. So it's a wonderful feeling of paying it forward. Like, yes, I did it. You can do it too.